Interventional pulmonologists by training are typically also ICU doctors. When I saw what we could do, that we could return breathing to people who were having difficulty, and that even people who were so sick that they were on a ventilator and now they're able to be home with their families, that was really meaningful. So our typical patient will have complaints of shortness of breath, of wheezing, of cough that are either diagnosed or have been untreated. As an interventional pulmonologist, my goal is to either diagnose a condition or treat a condition specifically with minimally invasive procedures. Sometimes it can mean using advanced technologies like robotic bronchoscopy in order to be able to diagnose what a nodule is, right? At other times, it might mean taking a condition that is already diagnosed, like COPD or like tracheobronchomalacia, and using our minimally invasive techniques to improve a patient's quality of life. Minimally invasive procedures do mean that we are typically taking the natural path of air to get to the lungs. And so these tends to be easier recoveries than major surgeries. Our patients are put to sleep, so they are comfortable during the entire procedure. Most of the time, an outpatient scenario, meaning that patients can come in from home, have their procedure done, and the majority of the time they can go home the same day. One of the most important things to me when I'm meeting a patient first time is to make sure that they're treated with the dignity and respect they deserve. I always want to make sure that my patients are heard, that their concerns are listened to. I do truly believe in informed consent, in telling people really what the data is and what our past experience is with their disease, with the knowledge that at the end of the day, they're the captain of their ship. My relationship with my patients is very special. There are some folks who come to me for a diagnosis of a problem only. And sometimes they need to move on to a different doctor because they might need cancer treatment or they might need a different surgery. And so sometimes our relationship is short-lived. There are other patients that we essentially become best friends forever. When I'm not at work, I am a mom of 3 kids. And so my life is quite busy. I'm really involved in my community here in Cleveland. It's one of the things I value the most, is being connected to the people I serve.